Hi, everybody. For those who know me, long time no see. And for people that may see this video that don't know me, I am Rain Solari. I'm reaching out to community once again because recently I've been diagnosed with a very difficult disorder. It's called complex regional pain syndrome. This is a very complicated illness, and it has to deal with the nervous system. Typically, this occurs after an injury to soft tissue damage or a surgery. Basically, the nervous system interprets lots of things as pain, like everything as pain. So, for example, if someone has sprained their ankle, the injury heals, yet the pain remains, and the pain becomes greatly disproportionate to the initial injury. And some cases, like my case, the injury occurred and it spread, the pain spread. So not only is the pain disproportionate to the initial injury, it spread throughout my entire body. And so basically this is nerve pain. And for me, it feels like an autoimmune disorder because the nervous system interprets everything as pain, and the signals get really mixed up. So I have trouble with my mobility, muscle weakness. You lose your muscle, skin changes, bones, joint issues. So sometimes my right hand gets just locked up. When I'm having what we call a flare, like I am now, I have to use a walker. Today was the first day that I used my walker in public. And that was, you do what you got to do. But my stage has progressed a lot over the past 4 months. When I'm in a flare, my body gets really swollen. I have pain literally from my scalp to my toes, my stomach, everywhere. I have full body CRPS. Treatment options are not, there's no cure. So it's just about managing pain and trying to reset that nervous system. Right now, I am getting pain management, but it's not working. Basically, they try to manage it with pills and physical therapy, all kinds of things. But the therapy that has been most effective for me and a lot of people with CRPS is ketamine treatment. Now, I just got off the phone with a ketamine clinic here in Clovis, California, and went over treatment options, pricing, everything, and it actually sounds like a perfect place for me to get treated for my CRPS. The cost is an issue for me, but it is fairly reasonable. However, as most of you know, I'm a single mother. I have a child who has autism, who is thriving. He's doing great. But adding the cost of like each treatment is $500, which is absolutely reasonable. No insurance does not pay for it. But I may be able to get reimbursed by my insurance. Not sure. However, each treatment is about $500. And at this time, you don't really know how many treatments you need because everyone's different. I am just going to say maybe 10 treatments to start off and see where we go from there, and hopefully I can go into remission. I encourage everyone to just look up complex regional pain syndrome. It is rare, but it is the most painful illness someone can have. On the pain rating scale, it surpasses childbirth, it surpasses cancer, um, and it's really debilitating. You can see now my eye is red. A couple of days ago, it was bloodshot because my flare happened only on the right side of my body. Started 2 days ago. So even like the nerves around my eye, in my eye, it's very painful. I have gotten a lot of support. I have friends that help me to come do my laundry and when I help me take care of my son and everything. But I need help to get these treatments. I need help in prayers, just community, anybody who has any ideas. But I need help for funding. I need the money to get this treatment that I so desperately need. So I'm trying to raise $6,000 to start. And I talked to the clinic and I can get in within 10 days to start this and have some relief, get off these pharmaceutical medications. Thank you for listening this far. And if you can help, great. Prayers help spreading the information and actually just getting informed so that the rest of the CRPS community has some support, and people being informed really helps because no one really knows what this is. So it's really hard for us to access support and resources, and it could be very difficult for people. So thank you for hearing me out. I do hope that you can help out and at least educate and spread the word about complex regional pain syndrome. Thank you for hearing me out. Have a nice day.